Excellent. Misty, are you okay to get started?
Yeah.
Okay. So welcome, everyone. Just a couple of house rules and friendly reminders. This is a shared conversation, so please do not put us on hold, as that banner message is pretty and all, but we'd like to hear each other talk. If you are not speaking, it'd be great if you could just put your microphone on mute, so that way we don't hear all the ambient sounds in your environment. Today's topic is social media in medicine and leadership, and our primary moderator will be Dr. Misty Johnson. And take it away.
Thank you all for the call-in today. Did everyone get a chance to read through the article a little bit?
Yep.
Yep, good. Because I was thinking the format of this would be to hear your thoughts and opinions about why social media doesn't work, why it should work, and how we can apply that to medicine. And then to tie up at the end, I'm making a commitment to make sure whatever conversations we have get back to the right ears within Banner, whether that's PR and how our patients see social media, or whether that's through our CMO groups, or whatever the appropriate group is to hear the messages and the content of our discussion, so we can utilize that to make social media use within Banner different or better than it is today. So thank you very much. So just a general perspective from if 2 or 3 people could pipe in their opinions. Prior to reading the article, what's your opinion of social media and medicine? And I'll pick somebody because I wrote down all your names if you don't volunteer.
It's a great way to just share all kinds of information. Some of it's kind of crazy and some of it's not.
Now, this is Scott Anderson. You know, one of the things that I've noticed the most is every time I Google myself, it sounds strange, I find that there are 45 different websites, all of which are unsolicited and review me and have different ways of describing me, and people have had good comments, bad comments. Half the time it's the wrong person, the wrong address, the wrong doctor, the wrong specialty. So in that aspect, I think I found it very frustrating and unreliable.
Okay. Anybody have a different opinion about it prior to reading the article?
This is Karen. I think it's just hard. You're overwhelmed with so much information to filter through it all sometimes.
So I'm hearing a lot about it's a great way to share, but it's crazy, unreliable, overwhelming, don't really know what to do with the information that's out there.
I'm not sure I heard anybody say it's a great way to share.
Oh, I think that was our first one. It's a great way to share a lot of information, and can be crazy or not sometimes.
Yeah, I can tell you for one thing, it's fantastic when there's a live event ongoing and you really want to know what's happening. For example, if there's ever a natural disaster, or like when the Libyan strikes occurred and political events, if you tune into the Twitter feed, you probably find a lot more information earlier than you would via CNN.
It's a good networking tool as well. It's a good way to, if you have a question about something, to find the right person to get the answer, etc.
Okay, great. Anybody else want to share any comments?
Fabulous for alternative healthcare.
For alternative healthcare. Okay.
Entry medicine, I guess, is the new term.
So a few points. This article piqued my attention, and I use the social media networks to find this. Google is a great resource for information, sometimes reliable and sometimes not, as you all have said. And what piqued my interest was why executives don't like it. Because I personally don't like social media much, but it's I think sometimes you have to look at it from the user's perspective versus our own perspective. Some of the comments in the article, the major headings in the article, perception versus position, the whole eagles flocking and networking, what's networking and what's social, and there's some fear around the content of it. To me, the first one, perception versus position, it's almost that as an executive or as a leader, you don't need the social media anymore. You've kind of reached your pinnacle. Eagles fly solo; they don't flock together. From what you all read in that article, what spoke to you in perception versus position? Does anybody share that comment? Why or why not? What resonates with you?
I think the perception out there is that this is valuable, but I think the reality of it is that it can be just giant time sink of pretty much irrelevant information. I think that's part of the gist of what the author was putting out there. And so that as an executive, he has to say to himself, why in the world would I spend my time with all this stuff that changes every 30 days?
Right. Now, one person said prior to reading the article, they felt like it was a good networking source or a way to make connections. Tell me how that changed. This may have changed your perspective on that, reading the first section.
I was just reading through that. I was the one that said that. This is Jennifer, and I guess it's all in the kind of person that you are and what you like, but this seems like it's a lot of, they're saying that it's just too much needless information. You don't need to know that, and it is true. If you look, it depends on what you're using it for and what you're looking for, and the people that just constantly tell every minute move they make, that's overwhelming to those of us who are busy and just want to use it as a networking tool. But it is a good way to get information out there. If you have a question, you can ask, those of you who have had experience with this, what is your, what have you done? What are your ideas and things like that. It's a good way to get a lot of response.
Jennifer, is that really applying more towards your audience? That you have a defined audience, or do you think that applies to the whole broad perspective?
I think it applies to your audience. I think it applies to your audience and how you use it, and who's looking at it, and who depends on the generation, the age. I mean, a lot of nurses are young and they love social media, and it's a good way to get their attention.
One of the things with it is it really depends on your network. You can get the message or a question or a concern out there, but like you stated, if no one's part of that network who you trust and a response from.
That's why I'm saying it's all in how you use it. If you're using, like say Facebook to connect with family, or you're using it, like LinkedIn, I find very useful for professional networking. Just depends on the venue too, and your audience. And YouTube is, we've used YouTube to do a lot of education and motivation, and I really like that too.
Okay. What are the fears? There was some good discussion in the article I liked about the fears and the fads, and if I learn this one, I'm going to be moving on to another one and trusting what you put out there, because it is being a little bit vulnerable sometimes, and there's lots of public risk sometimes in how we use social media. Tell me a little bit about fears and fads for you all.
I think somebody commented on this earlier, but one of the best lines in the article, I thought that was very powerful, was that a single tweet could completely destroy your brand, and that's really important, because a single one of a social media interaction that goes viral and goes across multiple networks to other individuals who are influenced or stakeholders in what you do can considerably destroy your brand. And that's a huge fear for anybody entering this.
It's hard to, when you're using it, it's hard to show what your intent is, or the tone, or it can be very damaging if, depending on what it's about, because just like email can be the same way. You can't hear the person's tone, you don't know what their intent is, and if you're in a bad mood, you might take it as bad, or if you're in a good mood, you might think it's funny and it's not serious,
That is very true. I think we've all been victims on one side or the other of an unintended interpretation or perception of an email. Shiva and I, as we were preparing for this, kind of had our own little bump about, and I put an exclamation point in. I think it may have come across the wrong way. So absolutely, we lose some of that personal impact.
And the other fear is that you don't have total control of some of it. Other people, depending on if you know how to use the settings on all of them, the fear a lot of times I have is that somebody is going to post something inappropriate on my page that I have no control over. And then that could really, damage not only your brand, but lots of different things. Just the way people read into things, like, oh, well, if they're friends with that person that would say that, then what kind of, people start making assumptions.
I think there's pressure, too, to get out enough tweets or, do enough of that so you're connecting, and so, the pressure to almost perform that way.
Mm-hmm.
Is that you, Trina?
That was Kelly.
It was Kelly. Oh, you sounded like Trina Bogart for a minute there, Kelly.
Okay.
So, Kelly, tell me a little bit more about pressure to perform. You mentioned tweeting and maybe tweeting enough or not enough. Tell me a little bit more about that pressure to perform and how you see that impact leadership.
Well, I just think that if you're spending a lot of time or you're putting a lot of your energy into doing that, so then that's taking away from the other things that you would normally be doing, and you want to make sure that you're staying on top of it. It's just that staying current, staying fresh, and it's just it's a job in itself, and I think it takes away from the job you're trying to do. Although, on the other hand, I'm afraid that this is something that we're going to have to deal with because it's here and it's happening, and so we're going to have to find a way to make some sense and to find out how we can use it in a productive way.
And thank you for that segue, because that's kind of great to move into the why we should. There's a lot of reasons we shouldn't, but the reality is that social media exists and it's used for things sometimes that we don't have control over. So how do we make it value added for ourselves? I think that really got to the gist of the next section of the article, where the author addressed some of what was important for him around making sure there's feedback and authenticity and transparency and what the data really shows. So let's transition into that. And why should we invest in social media? Why should we invest time or resources? What's the value add?
This is Kathy. There could be some value around increasing knowledge of certain service lines, could potentially increase revenue. We can increase education. And some of those things I have explored.
And how have you explored that, and what has been the result?
I've explored it with different service lines and reaching out to potential patients and showing services and being competitive with increasing volumes. And I have had actually some success, especially with younger populations.
And what you said about younger populations, I think that's the wave of now and moving forward, in that it's a boat that we can't not get on. We don't want to miss it. And it's happening. I mean, I was reading another article, and it was talking about how people are hired based on their score and how many hits they get, and it's really mind-boggling to me, but it's what's happening, and I don't think the next generation is going to be able to not have that as part of what they're doing, and if we're not involved in that, then we'll miss a whole generation of people.
Great. So that's an interesting comment, and it leads me to another question. Do we have the right generational mix within Banner and I don't know, say if you don't want to answer the question, or if we may not know, is there the right generational mix within leadership in Banner to fully understand the extent of the impact we need to have with that younger generation? And if not, how do we get there?
Misty, this is Margie. I
Yep.
think that is a great question, and I would expand it also, into some very specific parts that many of us have influence over in regards to physicians. So one of the things that I think is interesting when you take a look at generational differences, and this is not exactly having to do with social media, but just the generational differences that you're talking about,
Yeah.
what people want out of their careers. And, that's a fascinating topic, and it kind of fits with your question, and are we set up from a physician perspective to make sure that we've got opportunities across a broad range of career tracks that will keep people engaged within the organization, yet allow them to have lots of different types of ways to have a professional career. I think one of the things that I'm learning is that physicians in different age groups and different generations often like to do lateral moves, which is so different than what those a couple of generations ahead of them kind of take as a pathway. So I think it's a fascinating topic. I don't know that I have a lot of solutions to your question, but I think it's one that we need to definitely continue to have dialogue around and continue to try and understand to make sure that we're ready to meet the desires of physicians and other care providers that are in those different generations.
And Margie, that's really, to me, within BMG, there's that big focus on that open CMO position, and that really would apply to some of the work there, but it's within ALP too.
Absolutely. I mean, it's just fascinating to me when I think about that, and when I talk with lots of different physicians about what their goals are, what they like, and even when you do like exit interviews with people who are leaving BMG, I mean, frankly, most of them are moving to something that's just different. It's not often a step up. It's not more money. It's not a title. And when I talk to someone, they're just like, well, I just want to do something different. So I think our challenge is, how do we continue to make sure that we've got different opportunities to meet those desires, that they're organized in a way that also meets the organizational needs, and that we have a way for people to know about them.
This is where, partly social media has a role. Much like the yearly, voice surveys and pulse studies that we do across the Banner system. I mean, this is what the media is, social interaction and, daily basis through these channels is supposed to provide you as a pulse of your organization. And I just don't, I know Banner has a YouTube channel, they have a Facebook page, they have Twitter, but I don't know whether there's enough structure or goal behind how to utilize it for that purpose. I think there's a lot of fear, but out there about what's going to be there, but I don't think we're really taking advantage of the positive side of being able to really study some of what's really bothering employees.
Shivak, do you use Yammer?
I don't.
I don't either.
Yeah.
I wonder. I mean, is there anybody on the phone that uses Yammer?
But could you tell us what is it? Is it kind of like?
Okay, I'm like a social media.
I don't even know what it is.
So I think it's like a it's sort of like, is it like a banner Twitter? Who else is on that knows more about it? I don't. But I don't use it. I don't find it to be very effective for me for communication means, but I suppose that means that we're probably not using it very well.
Hi, it's Diane Ekstrand. I can try to give it a shot in a nutshell. It is something that is totally open to Banner employees only across the system, and it creates a venue very similar, Margie, to what you said, where you can connect with each other like you would at Twitter, except it's inside of the system, and you can network around, a topic of interest to a group of people.
See, I think that kind of tool would be very helpful. I think it's where you need more. See, I mean, we don't even know what it is for one thing, so it's going to require quite a bit of education as to what the actual tool is. Because I do think there's quite a lot of venues where this could work. For example, I'll choose a clinical venue. We have journal clubs, M&M conferences all the time. There's times when we discuss cases. There's times when we discuss, issues related to how we manage patients, not specific patient, but all patients. That's a conversation that can go on over time. That doesn't necessarily need to end in a 1-hour conference. That's where social media comes in to continue a conversation that not only expands from that small group to a large group, but also archives that conversation and allows other people to kind of review, that's the thought process behind why things were happening. And I think using social media as this sort of ongoing conversational tool where we're both learning and teaching each other is the right way to use it. And I don't think many organizations are doing that, and certainly not doing it well.
This is Karen, somebody actually said something about it being not really organized well, whatever ones were using at any point in time, and I have to agree with that. Like, what is a better way to organize it so you don't have to filter through everything? But one great advantage would be real-time feedback. It takes a while to get information back on the voice survey, and people have been thinking that way for a long time, and to have real-time immediate feedback would be a great benefit.
Yeah, I mean, for example, I don't know whether we have one here. I can give you an example. At Cleveland Clinic, the CEO, the chief of staff, for the entire organization have their own blog on the website, and they post something on it once a week. And they leave an open-ended question where employees can go and leave comments. I know we have something similar to that, but using social media to extend that out further to physicians, let's say to a particular physician network or a non-physician network, would be really beneficial to get feedback, like you said, at the time, at the right time, in real time.
I'd like to circle back to the article real quick. And the question that I think we're still skirting around during this meeting is, what exactly is the job you want social media to do for Banner Health? What are you hiring it for? And conversely, what do you think our customers are hiring it for? Those are going to be different applications. But unless you know what you want out of it, you're just spinning your wheels and you're sitting and talking about, IT fantasies and this ether world rather than trying to get some real deliverables out of it.
Ted, what do you want out of it?
Me as a physician, or me as a healthcare consumer?
Let's hear from you as a physician first, and we'll kind of do a round robin and see what everybody else has to throw in, and then we'll pose as a healthcare consumer to everybody.
Let's say as a physician, I don't ask for pretty much anything out of social media aside from maybe having a website with my picture on it. I'm nervous of the perils of it. As a consumer, I want an app. And we brought this, Dave Kokoska is not on the line, but this was one of his ideas a couple of years ago for even physicians and consumers. What's the Banner app? How do I get something on my iPhone that links me into the Banner social page or the Banner Facebook page or anything like that?
Okay.
I can access, where do I go to get my flu shot? Where do I go to get my labs drawn? As a consumer, that's how I would be using the media and the internet for this. As let's say an executive level on what I'd want out of the social media, I'd want basically a no-nonsense unstoppable PR platform that is nothing but good news coming out of Banner Health, flooding every social network and media site out there, just incessantly with the same message, not as a response tool, but as simply a PR tool.
Okay.
Depending on where you're sitting.
Who wants to throw in their opinion next?
This is Kathy. I agree. From a consumer point of view, what I'd like is a really easy way to access information about whatever question I had at the time, and also just to view various services, things that I could obtain for my health care, for my family, for my community. I think it would be really huge for a community.
Kathy, is that something WebMD like, or are you envisioning something different there?
I'm envisioning something like I have this app on my phone for CNN, and so all I have to do, this is the easy way to get news, but it just flashes as a text on my screen, and it gives me an update. There's been, tornadoes that came through. This is the outcome. So anything about politics, it all just comes through in a paragraph or less. So if I had an app on my phone, I could just download the app. It would be Banner Health, could give me the services that are available. This is where the community health fairs are. Did you know we're opening a new clinic in this area? Did you know you can obtain this for newborns? Are you knowledgeable that you need this much calcium per day? And it would just be these little flashes of information that would come across my phone.
So a health news flash.
Yeah. Right. And then as a healthcare executive, what I would like is the same sort of idea, except wouldn't it be cool if you could send, and since I'm a CNO, I'll say it from a CNO perspective because it's just coming to mind. If I could send out these mini blasts or obtain mini blasts from corporate, just think about how well communicated I would feel that I was constantly getting an updated message from Banner Health about what was going on, perhaps with the CCGs. That's a complaint I often hear. Well, I didn't know the CCG had this that they were going to roll out. I didn't know this date. I didn't know about delirium. I didn't know. Well, if you constantly got these little flashes over your phone, you would be able to feel that you were part of that communication real time.
I love it. What else?
Banner YouTube channel.
I think there is one.
So I think there is. I did one of these, internet teaching things. God, it must have been 5-6 years ago that we did a couple of those. But I think having 5-minute YouTube videos on, you got diagnosed with irritable bowel syndrome. This is what this means. You got diagnosed with hypertension. Here's what you need to do. I mean, you can reference people to the YouTube site or whatever site is out there now that's a lot more accessible than trying to find a Banner internet learning site.
I think that's a great response. You said Banner YouTube, and Shiva, was that you that said, I think there is one. I think. Is there?
Yeah, no, there is. I went on the Banner site just as we were talking. There is one.
But so wouldn't it be cool, though, if when there's a new video that's uploaded to that the iBanner app gives you a Banner alert across your phone saying there's a new Banner YouTube video, check it out. Well, like Kathy's suggesting. I love this. This is awesome.
Yeah, I think that's the number one thing with social media is, if we are afraid, our role is to curate what's out there and present it to either the consumer or whoever our directed audience is. You have to curate the social media because otherwise it does go wild. I mean, you can have people responding and saying, things that are irrelevant or lead things off track. But, another example would be if you're a primary care provider and you have a group of patients, every one of your patients, majority of your patients will have social media in their life. You could once a week or once a month, send something out to them that you find that's helpful for their health. Whether it be some new study that came out, talking about a certain type of diet or exercise or change in ideology regarding certain medications, and that could be how they follow their primary care provider for regular updates. It's sort of replacing newsletters and monthly emails to these are quick little updates that really take minutes to do. Some are 140 characters or less, and they can inform patients, and you're the curator as sort of the primary designer of the social media.
I'd like to flip that perspective, though, for a second. You're looking at it as a pushing, where you can push information to people. Let's say I am, Ted Norman, patient that got diagnosed with hypertension. The last thing I want on my iPhone is to get a blast from Banner 3 times a week about health issues that don't pertain to me at all. What I want is when I'm diagnosed with something, I want to pull something, and I want to pull only what's relevant to me. Because if we're pushing out a whole volume of information, there's no way anyone's going to pay attention to it. You want to have those resources readily available so that somebody can get in and pull it really fast. So when you look at it from the consumer standpoint, they don't care about, I don't care about mammogram screening updates as a male patient. But what I do care about is, hey, what about that new drug that just got recalled that I'm on? Maybe there's something on that site about it.
So this is Diane. What that reminds me of is how we have to understand preferences and provide options. So whether they're generational options that we talked about or just flat out personal interests like the story you just gave, but we have to make sure that we're prepared to work with each other in different ways and with our patients according to what's important for them.
Yeah, and there's multiple examples of this occurring everywhere. I mean, if you go to Google and set up a Google News feed, or you set up some kind of feed, you have options available to choose what type of information you'd like to receive. I don't think you should limit what you're sending out, but how the recipient is channeling that through this app, let's say, that app can channel out what's relevant to the patient versus not. The patient can say, I'm a male, I'm this. So if things are tagged as for women, because you can tag and keyword and whatever certain input, they can sift out those and only send through what's relevant for the patient.
So we can have a Banner app, what do we think, 6 months, Diane?
Boy, I don't know if I'm the right one to answer that. 6 days?
And I think these apps, too, can really supplement what we're trying to do, as far as the course of treatment with our clients, and more specific to just the type of clients that we have. But there could be an app that would provide extra, education or reconfirm what they're learning in their group, or reconfirm what they're learning, like for diabetic treatment or for, cardiac care or whatever the area happens to be. And that app could supplement what they're doing when they're in the hospital or in the clinics when they go home.
I have a question for the group, and how would you feel if you, in a public sort of social media forum, let's say whatever it is, have a complaint regarding something that comes up, or something negative in terms of feedback that comes up? I mean, all feedback is obviously not going to be positive. Likely, most is going to be negative. What would be an appropriate thing to do there? I mean, is this something that should be responded to in a public forum so people understand the transparency of what a physician and physician's team or organization is thinking, or otherwise?
With our Colorado Medical Society, we actually had a couple of consultants come through over the last year and talk about that very episode, because on health grades or anything else, if you get a bad rating, what do you do about it? The universal PR response was, aside from sending a note that says, we'd be happy to discuss this with you further, please give us a call. The idea was to not respond, not address it, and not go into it, because strangely enough, the more posts and pings and bites you put on that, the higher Google ranks it. So when you start searching for, let's say, a provider's name, if you've got this back and forth going on with somebody on a separate website, you're actually more likely to have that show up in your search engine, and then people are going to start seeing that.
Wow.
That makes sense.
I never would have thought of that either.
Delete,
Never
delete.
respond online to negative reviews.
Hey, this is Margie. I agree with Ted. That's pretty much, I think, our universal PR perspective from a Banner Health perspective. I think one of the concerns that we have is when you start getting into that is, where is that line for the confidentiality about the patient when you're in that doctor, physician, or provider patient relationship? That makes it sometimes difficult, even if from the PR side perspective aside, as well as what Ted just talked to us about how Google ranks, of maintaining that personal, that private relationship with a patient, even if they or a family member decided to take it more public.
That becomes a slippery slope too in like behavioral health, for instance, if somebody were to, get online and start saying that they were, suicidal, or, that just opens up a whole can of worms.
So Shiva, do you have a response to that?
I'm thinking about it. I guess, yeah, no, I'm thinking this is it's kind of a one-way street in terms of communication then. Really, we're looking at social media primarily as we send you information, and that's it. And when you send us something, we'll likely ignore it. That's, I don't know whether that's effective use. I think that might be appropriate use, but I don't know if that's going to be effective use and help achieve a goal that you might want. Really, it's just a blast, notification system. That's what we're suggesting utilizing it for.
Right. So it takes out that blogging, because that is, you do get a lot of those back and forth discussions that could get into some confidentiality issues. So it certainly makes blogging less part of the package. Is that what you're saying?
Yeah, I think, in my opinion, that severely limits its use. And I would have to agree with everyone else in the sense that, it's kind of useless. It's just then a way to send information out to a lot of people. And it's not really networking. It's distribution of data.
This is Diane. What that just reminded me of is I had a recent conversation with my 16-year-old son, which, believe it or not, I think is really relevant to our conversation today. But we were talking about how he socializes, or if you want to use the word network, or how they get their schoolwork done together, and how they leverage social media to be socially interactive with each other, but just to flat out get their schoolwork done. It amazes me because they're doing things in ways that I never did when I was his age.
What ways is that good?
Oh, so I've talked with him, and again, we got to think that these are patients of ours down the road now, as a child, but in a couple of years he's going to be able to take care of his own health care, and he's going to want to interact with us in different ways. But I shared with him, I said, if you can interact that way, but also not lose the face-to-face interaction and the relationships that need to be built up when you hit the workforce, that's important too. So again, it's funny because he just thinks of it as, I've got multiple ways to get things done and communicate and get work completed.
Yeah, but
it's options.
That's going to be the workforce, so he will actually be in the majority, and we will find ourselves in the minority in 10 to 15 years. Unless
we're the ones who design what they're going to be doing.
Well, you can never design what the customer's going to do with technology, though. That's the beauty of innovation, I guess.
But why can't we innovate those ways? That still has not been done. And I think we can't be afraid of this. I mean, look at CNN. We were just giving an example about CNN. CNN, the last thing they want you to do is to go off their channel on TV and look at something on their website, because their advertising dollars and everything that they're getting is going to be a lot less. But they're leveraging their iReports, their Twitter sites, their Facebook status, their apps, because they want you to get the information so you're connected to their brand. And it's a way
they want to sell advertising.
But because you're connected to their brand, I mean, they're selling a lot less when all you do is, follow the CNN Twitter page, right? They're not selling anything on the Twitter page, but you're connected to their brand. It's a way for people to connect. And if we need to understand what our customers want to connect to. It's not how we want to give them information, it's how do they want to get it. And maybe we need to survey our patients and find out what our patients want. And I don't know if that's been done by Banner to figure out what patients would like and what employees within Banner would like, what other physicians would like. And maybe that's how we direct as to how much resources should be delegated for social media.
The other thing I would add about this.
You're right in the fact that if people want information or we want them to connect to Banner, we want them to think, oh, well, I'll just go to whatever Banner has to look. It's our branding and our company and our healthcare organization. And if you have that branding, like most people, when they think of news, they want to go to CNN. So when people want healthcare, we want them to think to go to Banner. Right. So how do you get that out there with social media?
Well, that's the thing. I mean, I doubt a second, a 12-year-old, a 13-year-old, 14-year-old is going to be turning on the TV and going to CNN. They're going to have their iPad on the CNN app. That's how they watch CNN.
They are.
And they'll be following the Google Reader, the Facebook page, the tweets, and then they're going to be responding to them with their network and sort of creating their own reality of what's happening and discussing it. And that's outside of what, the boxed model is. And we need to step out of the boxed model of how we deliver information and figure out how our patients want it and figure out how our employees want to receive information a little bit better.
Well, and I think that nowadays too, that, people want to get information quickly. They know especially the younger generation, they've always had the internet. They can have everything right at their fingertips right now. So how do you get it to them quickly? And if somebody has a question or they want to know something, they would much rather send an email or look on Facebook or send a message to something than to pick up the phone and call somebody. It's too time consuming for them. They don't want to talk to people. They just want, hey, I have this quick question, give me an answer. And I think that you get more people to be involved I can be talking on the phone and still send a message on Facebook or text somebody, or you can be talking to multiple people at the same time. And I think that this younger generation, they like that. They're used to that. It's easier for them than picking up the phone and calling on the telephone. I don't know how many of you have teenagers or young kids, but my kids would rather text me than talk on the phone to me.
I don't think my son even uses his phone for talking.
I don't either.
It's all texting and working off of the internet and all those ways that you're talking about.
And they find stuff on the internet and for answers, and
I even have my 80-year-old mom texting.
Yep. I think whatever we do, it has to be easy to use. When it gets too convoluted, then people just give up or decide forget it. So it's got to be organized, smooth, and easy to use.
There's always this fear about privacy and what's going to be out there in the medical legal side of it. There has to be a way you can design the system to circumvent these problems. There has to be a way you can utilize this to interact with patients and circumvent these problems of privacy and the legality of it. I think that we just need to put more thought into how, and maybe get some of patients on the board or the team to help organize this, to have their opinions, in addition to some of the providers that are using these tools right now.
Love it.
I mean, one of the places where this is being used tremendously is concierge medicine. I mean, massive concierge medicine practices like MD VIP and all these practices, they leverage social media for every one of their patients. Patients interact with physicians through Twitter, through web conferencing, FaceTime, text messaging. They follow their Facebook accounts. They interact with their patients, and the goal is, and this is the idea of the patient-centered medical home, is you're preventing people from coming to you with acute problems because you're picking up on things earlier. And you're doing it in some environment that they must have designed to circumvent those issues.
I'm going to go ahead. We're down to just a few minutes left before our time is up. I'm going to recap a few of the high points that I'm going to, again, make a commitment to communicating back to Banner, because Banner is an innovative company, and I think there's a lot of content here that will be interesting on various levels. There's a lot of fears. There's a lot of barriers to making it successful, but I'm hearing that the main, what you all think the main uses would be to the consumer, and the consumer is defined as each of you, the people you work with, the care teams, the Banner employees, but also the patients. An easy-to-use app or resource of information where we can both push information, but the patient can pull pertinent information or maybe even customize the type of